This is the David Doel Show on In-Depth Radio, News Talk 1010.
Welcome to the David Doel Show, your rational look at news, politics, and culture, right here on In-Depth Radio, News Talk 1010. I, of course, am your host, David Doel, and coming up on today's show, Metrolinx is banning some employees from off-duty cannabis use, despite the fact that cannabis is legal. I'll open up the phones to get your thoughts on that in the next segment. Also, in the off chance that Jagmeet Singh can't win his by-election, should he step down as NDP leader? Some off-the-record insiders think he should. And later on in the show, should we decriminalize psychedelic mushrooms? Denver, Colorado, and the state of Oregon are considering it, and I'll tell you why it's a great idea. All that and much more coming up on the David Doel Show. But first, this week we were hit with the news of a leaked draft bill that appears to show the Doug Ford government is planning to open aspects of our healthcare system to privatization. Joining me by phone to discuss that plan and what this means for Ontarians is NDP MPP for Brampton Centre and NDP Deputy Leader Sara Singh. Sara, thank you for joining me.
No problem, David. It's a pleasure to be here.
So,
Thanks for having me on the show.
So this week, your party obtained and leaked a draft bill from the PC government called the Health System Efficiency Act that would essentially dismantle regional health agencies known as local health integration networks and create a super agency to oversee the health system. Now, there's a lot of sort of complex language around this bill. I think people are having a hard time understanding how exactly this may affect them. How would you explain to people what this potentially means for them?
Well, I think for a lot of people, it is confusing and, the consultations haven't been complete. And so they haven't really had input in terms of the decisions that are being made, right? And I think if they were involved, they would have an understanding of what this government is deciding to do. But I think for, the general population, this bill really does signal to us that this government is intending to privatize aspects of our healthcare system and potentially create a two-tier system here in the province of Ontario.
So, were you caught off guard by this, or is this the kind of thing where, we've seen Doug Ford's and his government's, their inclination towards private interests. Is this something you sort of expected to happen, or did it catch you off guard?
No, I think it caught everyone in Ontario off guard at this point because, I think we were expecting that there were going to be consultations with frontline workers to understand, again, the transformational change that is needed in our healthcare system. I think we all expected that there was going to be changes that would happen, but that they would be done in consultation, again, with communities and the public. And that hasn't happened. And so what is catching us off guard again, but not by surprise, because this is a pattern with this government, is to go ahead and just make decisions without, again, including the community. And the timing of this, I think, is what's really unfortunate.
So how would, this, it all seems so, it's a little abstract, the language in this bill, but it does seem to indicate a step towards opening it up to privatization. Is there any way that you see how this could potentially maybe improve healthcare in the province? Are there any aspects of this that you think are good?
No, absolutely not. I think, when we look at our public healthcare system, Medicare system, this is something that we pride ourselves here on in the province of Ontario and frankly across Canada. But, this rationale to create, again, a two-tier system means that those dollars are going into private corporations. We're essentially creating a climate that's going to allow, for corporations to benefit. And we're going to see sort of, this plan seems more like a cash cow for those corporations rather than investments in our healthcare system moving forward. And so I'm not sure if that's the right approach. I think what we need to see is that those dollars, those public dollars, need to go back into a public healthcare system, and they need to stay there, not be siphoned off into the hands of those corporations.
Yeah, and just on that privatization note, we've seen the American healthcare system and how disastrous it is, and this. Clearly, this is not what the American healthcare system is, but it is a step towards more privatization. And in the U.S., you have 45,000 people a year die due to a lack of access to healthcare, which doesn't even really exist here. You also have the fact that medical bankruptcies are the most common form of bankruptcy in the U.S. So this idea of even having a two-tiered system, I think what it would do is it would take the focus off of our public system, where essentially the wealthiest people in this province would have the ability to pay for better health care. Is that a fear that you have?
Absolutely. It's a fear that we have. And also when you do sort of privatize aspects of the healthcare system and, farm out services, again, it's private corporations that are providing those services. And this government is trying to build that as a more efficient and effective model. But in reality, what's going to happen is costs are going to skyrocket because, again, it's going to be at the hands of corporations who are deciding what those look like. And so it is Ontarians that are going to be paying that price in the long run, both in the quality of services that they're receiving, but also in their bottom lines. And I think that is really concerning. While it seems what they're billing to us in the short term to be a rational solution, in the long term, as we're discussing, David, it's going to have serious impacts on who can access healthcare and the type of services that they're able to access.
Mm-hmm. And I've also been bothered by the language around what the Ford government sort of pretends that they are doing. So to give you an example here, the health minister, Christine Elliott, on News Talk 1010, she was on News Talk 1010 this week to promote Bell Let's Talk, which is about raising awareness for mental health. But in that same vein, so this week, Premier Doug Ford said, we were able to get the federal government to match his government's promise of $1.9 billion over 10 years in funding for mental health, which is actually not true. So the federal government had already committed to that before Ford was elected. It was even in Patrick Brown's platform. So this is the kind of language we've seen from this Ford government, where even on aspects of policy where you could maybe give them some credit, there really is no credit there because they're simply taking credit for something that was already there. So, this whole, I guess my question here is what would an NDP government, or what do you think should happen in terms of improving our healthcare? What would you like to see the Ford government do to actually improve our healthcare system here in Ontario?
Well, I think, at this point, we recognize that across the board, from communities like mine in Brampton Centre all the way down to, Windsor and up to communities like Timmins, healthcare in our province is in crisis. And I think we should be looking at ways to invest in frontline care, make sure that we're also providing supports in communities so people that don't end up in crisis in the first place. But what we're seeing actually from this government is a clawback on those investments. We're seeing them move towards privatizing our public healthcare system. This is not the way that we're going to ensure more effective delivery, and we're not going to ensure that rural and remote communities are getting access to healthcare. So we need to be investing, because when we invest in healthcare, we're investing in communities, and we're actually investing in the health of our economy when we want to have that larger discussion, right? And so I think we need to not be looking at, cutting those services and privatizing them. I think we need to be looking at investing and creating more opportunities to ensure people get the supports that they need. But, David, I know you're well aware of this, but it also is about poverty reduction strategies being put in place that also have an impact, a positive impact on how people access healthcare, right? If people are not living in poverty, are not struggling to make ends meet, they're less likely to be facing many of the health outcomes or mental health outcomes that those vulnerable communities are facing. And so it's investments across the board that need to happen, not cuts to our services at this point. And that's something an NDP government has committed to. It's ideas like dental care and pharmacare that we need here in our province to ensure that, again, people get the access to the right types of services that they need. And it's not just when they're in the hospital, it's when they leave. So it's a multifaceted approach that's needed. And that's not what we're seeing from this government at this point. And it's really, really concerning and frankly disheartening.
Yeah, it's a great point about investing into different areas and understanding that when you invest into, say, poverty reduction, how that does positively impact healthcare and other areas as well. And just on the privatization aspect of that, Matt, we've seen the 407 or hydro. When we've privatized these various industries, we have regretted it every time. So
Absolutely.
So this idea that privatization is the answer, all we have to do is look at history. It boggles my mind that
it absolutely does.
Yeah, that people
the
even
Liberals started this mess with Hydro One and the Conservatives with the 407. These are great examples of where we use them as ways to say to the public that we're going to create more efficient services and it's going to be better service delivery. But at the end of the day, it's our taxpayers that have paid the cost for these very poor decisions that were made by the government. And this Conservative government is frankly taking us to an even worse situation, and it is really, really concerning for us all.
Exactly. So before we go, I want to get your thoughts on what are some other policy moves that the Doug Ford government has done that have concerned you?
Well, right now the Minister of Education isn't coming forward and being very clear with us with respect to what's about to happen to full-day kindergarten for children in this province. So I think across the board, this government is just jumping the gun without finishing consultations, putting forward ideas, and I wish, again, to your point, I wish I could credit them for some decisions that are being made, but at this point, there isn't much that I can give them credit for.
Yeah, totally. I mean, the funny thing is there are so many different aspects we can go into, like whether it's
so many. We
the
can
minimum
have now a long
wage cap.
Conversation.
Yeah, the minimum wage cap and trade, sex education, cancellation of 2 paid sick days. I mean, go down the list. There's just disappointment after disappointment. But Sara Singh is the NDP MPP for Brampton Centre and the NDP deputy leader. Sara, thanks again for joining me.
No, thank you so much, David. It was a pleasure chatting with you. Have a wonderful night. Thank you.
Thanks, you too.